About every 15 minutes, someone dies from an alcohol or drug-related accident. That startling fact motivated Eden Medical Center's Trauma Center to begin and participate in a program called Every 15 Minutes.
911, what's the address of the emergency?
I was a part of the crash. I was a victim.
There's been an accident. I don't know what happened.
I died.
It's everywhere. I heard it.
I was hit by a drunk driver, and I was in the back seat of the car. And I remember just laying there and having a bunch of emergency firefighters come in and just taking out the hood of the car and telling me that it was going to be okay. It wasn't real. I mean, it was real, but it wasn't for real.
Real enough to make a lasting impact on students, parents, even teachers, and hope they won't end up in a trauma center or worse. Eden Medical Center's trauma coordinator, Travis Maley, explains how the Every 15-Minute program works.
In the United States, every 15 minutes, somebody dies as a result of drinking and driving.
That's going to officially determine these
While you may not be the one that is drinking, and you may not be the one that has caused the accident, there's a very real possibility that you'll still end up in this room, in this trauma center, as a result of drinking and driving.
There were 25 students picked out of our junior and senior class. And what happened was every 15 minutes during class time, they would go on the intercom and they would say a name, and they would say so-and-so has died from a car crash related with alcohol.
During the two-day program, Eden Medical and emergency workers stage a fake but very real-looking car wreck. 20 to 30 high school students are chosen ahead of time to play the role of trauma victim.
We try and make that as real as possible. And that involves moulaging the kids, and they have what looks like bones sticking out and they're bleeding. Some are brought by helicopter to Eden Medical Center, some are brought by ground to Eden Medical Center, and everybody who is involved in a trauma is involved with these kids, and we try and make it as real an experience for them as possible.
Being in there, I just remember 10 people like coming at me and having so many machines. One of the doctors had said that I died at a specific time. And then everything just shut off, everything got so quiet, and everyone just left. That kind of hit me like, whoa, like this is what it's really like. And to be in the trauma room, like I don't want to have to go through that again. Yeah, it's pretty tough.
Tough enough to keep Michelle, her friends, and even her parents aware of the real trauma of drunk drivers.
Well, even though it's not a real thing, I was really traumatized when I went inside the trauma room. I saw my daughter with like a makeup thing with a lot of red thing that represents blood.
Talking to my classmates who were actually involved and they were a part of the audience, they said that it was real, happening right in front of them. And to actually see the students and to see classmates and friends, to actually see them involved in the crash and as if it really happened, it hit home for a lot of people.
What a very powerful experience. I could see how this could absolutely impact the students and their family. And so I understand that Eden Medical Center does a debriefing of sorts for the families, for the patients. Tell me a little bit about that.
Well, Peggy, we start with the family members and their teens. We let them know just exactly what we're going to do. We're going to try to recreate the trauma situation, make it as realistic as possible. That really hits home for teenagers when they go through the experience. The participation that they have, the makeup that they put on, it's very realistic, and we try to make it as real as possible. By the time we're done, I'm pretty sure that most of these family members really feel like they've been through a trauma.
And it's helpful, right? That's how Eden and why Eden got involved in this?
I think it's very helpful. You know how hard it is sometimes to relate to teenagers? When they experience something like this, it really hits home for them. That's when they start talking with their families, they start talking with their friends, their emotions get going, they get really involved.
And the students evidently too, not just the ones participating, but there's students at the school actually watching this happen.
Yes, the entire sequence is videotaped and is played in the auditorium. And as I said before, we make it very realistic. I know that some of those audiences have cried, they've screamed, they really believe that what's happened has happened. They get very emotionally involved, and they find it to be a real learning experience.
Yeah, and a good learning experience at that. Now, what happens, I know some people have asked me this, if there's an actual trauma going on when this program's going on?
Well, you know, in the trauma bay and in the emergency room, we have overflow. So if real trauma patients actually come in while we're trying to film, we'll move them into the overflow areas. We can put them aside for just a few brief minutes while we take care of the real trauma victims.
No, okay, so everybody's winning here still.
Everybody's going to get taken care of.
Everybody's winning. As a trauma physician, from all the traumas that you've seen, what would you say if you had to give the most important message as far as avoiding trauma to first teens and then also family members, parents?
Well, probably the most important thing with teens and with everybody, but with teens especially, is prevention. Not using substances, not drinking and driving, having a designated driver. If you're riding your bike to school, kids this time of year, they need to wear their helmets all the time. Wear your seat belt. Of course, cars with airbags help a lot too. These all have been great strides forward in preventing the severity of trauma.
What should, if someone we know or love ends up in a trauma center, what should we do to help support? What should we do as a family member or friend if someone ends up going to trauma? It can be, you know, a traumatic experience for everyone involved.
Yeah, the first thing you should do is call the trauma center. Don't necessarily leave and go there immediately. If there's multiple injuries, the paramedics may actually have more patients than one to take care of. They may have to divert various people to various different trauma centers. So the first thing you want to do is call, find out where your loved one might be, and let them direct you towards which trauma center you'll be getting your information from. Every trauma center is required to have an intake area where they've got updated information. The average person has to understand that they're quite busy. They may not be able to give you minute-by-minute information, but they'll have that information available to you. And if you go there, they'll do the best they can to keep you informed and get you involved as soon as the patient's stable.
As soon as they get them stable. So absolutely call first. Now, when we come back, stay with us because we're going to tell you how you can find out more about everything here we've talked about today on Your Health Matters.